Hey everyone, hope you're doing well. I just wanted to pop on really quick because yesterday I was talking to some friends. We had a wonderful, wonderful birthday parade for a Sweet 16. It was my first and it was great. I really haven't been out socializing and the girls have really been doing a good job of social distancing. So it was really great to see them together. And one of the things that came up in conversation with the moms was this feeling of fear and anxiety that's been going on with this whole coronavirus, right? There's a lot of unknown, and what if I get sick, or what if someone in my family member gets sick? What's going to happen when we reopen? Are we going to be, what's life going to be like, right? So there is and has been a lot of this going on, and I talk about chronic stress with my patients all of the time because I really feel like our bodies were designed to deal with bouts of stress, but not chronic stress in a sense of every day, every year, and just, decades of stress that's building up. We can't get rid of stress, but we need to find better ways to manage it. And if we have these chronic levels of stress, right, first our fight or flight response, our adrenaline going, but then over periods of time, our stress hormone cortisol, if that is continually being elevated, it can lead to a lot of problems like things that you typically know of stress causes, high blood pressure, but did you know it can lead to consistent elevations in blood sugar, so contributing to diabetes, immunocompromise or immune system problems. It can lead to gastrointestinal problems, and of course, depression and anxiety. And what I talk a lot about, because I deal with a lot of women who are dealing with menopause and weight issues, is that stress can really lead to difficulties in sleeping, and also if you're not sleeping and if you're having chronic amounts of stress, it's going to increase your hunger and your cravings, and you're going to have a difficult problem in terms of managing your weight if you continually to have this chronic stress going on in your life. So what ways can we really implement? What can we do to manage the stress if we can't get rid of it? So of course, we always talk about things like getting to bed early, relaxation breathing, meditation, yoga, taking a walk, being out in nature, feelings of gratitude, things like that. But I love using this device from a company called HeartMath, and what it does is it monitors your heart rate variability, so you can actually see what these things that you're doing, if it actually is benefiting you. So I found out by doing this heart rate monitor that alternate nose, alternate nostril breathing really puts me in this state of coherence. And coherence is a state where our mind, our body, and our emotions are really in sync. And so it helps put our body into a state where, things can function better, we can think more clearly, we make better decisions, we're not as quick to respond to stress, because certainly sometimes, over the last few months, my fuse has been low, so we can really implement these techniques on a daily basis to help with our threshold of our stress, because it is all about being resilient. We want our body to be able to handle these ups and downs in our emotions. So anyhow, when we experiencing these calmness, peaceful relaxation, what I call regenerative feelings like kindness, gratitude, love, appreciation, that puts our bodies in a better state of coherence, and we physiologically and mentally we function a lot better. Our nervous system, our heart rate, our heart rhythm is is in a better state to function better. And then we're in the opposite, like depleting emotions such as frustration, anger, resentment, and stress and anxiety. Those emotions are putting us in a state of incoherence where our body is releasing hormones, our nervous system's on overdrive, and it is causing a lot of damage. So you can use those techniques, but if you want to really measure it and gamify things, you don't have to get this if you don't want to. And I really think that some of the like the iPhone watch and some of the phones have this technology in it as well. So I just wanted to let you know about that, especially because this seems to be top of mind for a lot of people right now. And I was just discussing that with some of our friends yesterday, and I really, really hope that helps. All right, have a great rest of the weekend. Take care.